as I understand it, you're creating software, electronic health record systems for the clinicians that are offering some of these alternative treatments, ketamine being one of those examples.
Yeah.
And you're trying to support them in aggregating data across patients that are receiving these alternative treatments. As I understand it, these clinics have been around for a while. What are they currently doing? Why is it not really organized in the way that you envision? And how are you hoping Osmind improves that?
I think a lot of these practices are actually on the newer side too. So many new practices are popping up in anticipation of FDA-approved psychedelic medicine, and even things like TMS are only, I think, 15 or 20 years old. So relatively new in the whole life cycle of healthcare. But yeah, a lot of these practices are just using pen and paper, or they're using software that's really not well suited for their needs. So especially with this patient population, people who are treatment resistant and who might be needing to seek help over a long period of time, it's really important for the practitioner and for the patient to have a strong bond, or to have a ways of communicating, and for the practitioner to be able to monitor the patient. And so one unique thing, for example, that our EHR does is that it is integrated with a mood tracker for the patient, an app that patients get to use throughout their treatment and thereafter. And that allows them to fill out, for example, validated questionnaires of how is my depression or my anxiety based on their diagnosis. And then that the physicians or the practitioners get that information, and that really helps them, because sometimes they don't know when patients need to come in for another ketamine infusion, for example, or they're coming in at inappropriate times. So really tailoring to the individual of, gosh, I'm really not feeling well now, it's time for me to see my practitioner. Especially with ketamine, there have been studies that it really helps with acute suicidal ideation. So getting people in at the right time is really important. So that's just one thing that the software does that a lot of practices now just have no clue and are flying blind on how their patients are doing, even after a number of treatments.
With ketamine specifically, what does that process look like as a patient? Do I go in one time and I take some ketamine and I'm done, or do I go every week? Yeah. What's a typical protocol that patients go through?
Really good question. There's a number of different ways that practitioners are administering ketamine, and it's actually pretty interesting. Like, we're interested in this as a research topic of what protocols are most effective for a given patient based on their medical history or their demographic background. But the common protocols involve differences around the route of administration. So the two main types of ketamine therapy are either more like ketamine infusion type therapy, where it's a therapeutic treatment. A patient is coming in typically 6 times over about 2 to 3 weeks, and they get a 40-minute or so infusion. And that's shown to help a lot with acute suicidal ideation. Typically, the patient is then coming in maybe every month or every 2 months after their initial set of 6 infusions. And so that's, shown to have a very high effectiveness rate. I think some studies put it at about 70% effectiveness rate for that type of protocol. And then the other main type is ketamine-assisted psychotherapy, which is typically administered orally or injected intramuscularly. So this is typically done in conjunction with therapy itself. So because the onset of the ketamine is not as strong as getting it infused in your body, patients are able to talk through different experiences they've had with therapists. And that's a different type of healing process than just the therapeutic intervention of IV ketamine. I think, jury's still out around what is most effective. And I think the field overall has a lot of different opinions about it. I think some people think that ketamine-assisted psychotherapy might have longer term effects, where therapy is actually working at the root of problems. Whereas people on the ketamine IV side believe that the therapeutic effect of ketamine itself is highly effective. So lots of research questions that we're interested in, and we're actually trying to address through the software too.